So tell me a little bit about One Up Health and your story. How'd you get started with it, and what's the problem you're really trying to solve?
Thanks. Yeah, so I always say that I'm really not a healthcare guy, but my early career, I worked at Presbyterian Medical Center in New York City. It's actually where I met my wife, who is the director of medical records, and we built a chart tracking system. And sometimes it feels like all these years later, we haven't really advanced too far beyond that. And so I then spent a lot of my career focused on building systems that affect the consumer and how they live and operate. And so I figured as opportunities kept presenting themselves, and a bunch of my investor friends asked me to get involved in One Up Health almost 3 years ago, to take a really good idea, which is to provide for initially patient access to medical record data across an app or through an API. But to do that more broadly, I came in to help operate the company and build really ultimately what's going to be the data infrastructure for the industry using this data standard called FHIR, FHIR, which then acts